Hello, everyone. Thank you for joining. We will get started in just a moment. Okay, we're going to get started. Hello and welcome everyone to our webinar, Using the Disability Data Dashboards to Advance Policy and Advocacy, presented by staff from the Lurie Institute for Disability Policy, the Community Living Equity Center, and the National Research Center for Parents with Disabilities. We're so excited to have you here to talk more about our disability data dashboards. My name is Maddie, and I am a communications specialist at the Lurie Institute. As a brief visual description, I'm a white person with blondish curly hair wearing white glasses and a collared shirt with a black tie. And before we get started with today's presentation, I want to go over some information about Zoom and accessibility. This is a Zoom webinar, which means your cameras will not be on. Only the presenters and the hosts will be seen. Additionally, for accessibility purposes for our screen reader user attendees, we have limited the chat so that you can only message the hosts and the panelists, but not the entire group of attendees. Please utilize the chat if you need to let us know if you have any accessibility concerns, for example, if you cannot see the interpreters. Speaking of interpreters, we have American Sign Language interpretation available. To view the interpreters, click the interpretation icon. It looks like a globe at the bottom of your screen. A small menu will appear and you will click American Sign Language. The ASL interpreters will appear in an independent window that you can move around on your screen. Thank you so much to Melissa and Alicia for being here and being our interpreters. For ASL interpretation on your phone, the interpreter will be visible next to the presenter's videos. We also have closed captioning available. To turn captions on, click the CC button at the bottom of your screen. Next slide, please. Lastly, we have the Q&A function available for you all to ask questions. You can click the button with two speech bubbles that says Q&A on it in order to ask a question. Feel free to send questions at any time, and our presenters may try to address questions during the presentation at the end if there's time, but we will certainly send out a frequently asked questions document alongside the recording and slideshow at a later date once the recording is ready to be shared. So thank you so much for listening. I will now pass it to our first presenter, Teresa, who will introduce herself and start the presentation.
Thank you so much, Maddie. Good afternoon. I am Teresa Nguyen, and I'm the director of the Community Living Equity Center here at the Lurie Institute. A quick visual description of myself. I am an Asian woman with dark brown hair in a bun today, sitting in a wheelchair and wearing a short sleeve pink collared top. So just to begin our presentation, I want to acknowledge where we get our funding. The contents of this Community Living Dashboard were developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research. The dashboard is also funded by the Robert Wood Johnson Foundation. Next slide, please. So today you're going to be hearing from Lauren Bixby, myself, and Nicole Wilmerson, all from the Lurie Institute, reiterate that you will be hearing from all three of us today, and we will be introducing ourselves as we go through the presentation pieces. Next slide, please. So for today's webinar, our objectives are to help advance the understanding of the data dashboards and its relevance to diverse stakeholders. We want to help you develop skills to utilize the dashboard data within your organization and or advocacy efforts. And then lastly, we want to identify how the data dashboard can support the disability community, policymakers, advocates, and other stakeholders to advocate for data-driven responses for equity in policymaking. Next slide, please. So I want to speak a little bit about the Community Living Equity Center. Our center examines barriers and access to community living, services, and supports for underserved people with disabilities. And our center has created and developed the Community Living Dashboard, which is what I'm here to talk to you about today. It is a tool that provides advocates and policymakers with an understanding of who needs long-term services and supports and who receives Medicaid long-term services and supports at state and national levels. Our advisors here at the Community Living Equity Center and other stakeholders, including the majority of people with disabilities, advised the development of the accessible and interactive dashboard at all phases of the design process. And then we have made it a little bit interactive where you all can look and apply filters to look at disparities by age or race and other categories, which we will discuss later on. Next slide, please. So I want to emphasize that, data is an important tool that advocates, policymakers, state officials, advocacy organizations can use to support people with disabilities in their state to really better understand the unmet need and utilization of home and community-based services in your state. And I want to add that this data can also be used to leverage resources and funding to help address the gaps in services and programs in which you identify through the dashboard. Next slide, please. So why does the data matter? It matters because prior to this, research on racial disparities in long-term services and supports has primarily focused on nursing homes or Medicare home health rather than home and community-based services, due in part to substantial variation in home and community-based services across states and also limited data. This data matters because lack of data hinders the development of policies and interventions to address the institutional bias and improve access to home and community-based services. Data is essential for rebalancing efforts that allocate Medicaid, long-term services and supports funds and services away from institutionalized care and towards community-based settings. Next slide, please. I think I've mentioned this throughout the presentation, but this data and this data dashboard is relevant to so many of our communities, including advocates and families in the disability and aging communities, policymakers, researchers, HCBS or LTSS providers, public health workers, direct care workers, and other stakeholders who are interested in LTSS need and utilization. Next slide, please. So, so how can the Community Living Data Dashboard be useful for advocacy? It can be useful in identifying specific populations for targeted policy interventions. It can help you understand how current policies or litigation may disproportionately affect certain populations by race, ethnicity, sex, or age. It can help defend Medicaid by providing estimates of who receives LTSS. You can use the demographic information in the dashboard to tailor messaging to specific audiences. And lastly, you can protect Medicaid expansion by showing who needs LTSS, including highlighting the percentage of people above the federal poverty level. I'm going to hand it over to Lauren Bixby to kind of give you all further information and a demo of our dashboard.
Thanks, Teresa, and hello, everyone. I am Lauren Bixby, a research scientist here at the Lurie Institute for Disability Policy. I work closely with the Community Living Equity Center and helped create some of the data that went into the dashboard. So I'm going to give a little bit of a demonstration and with some examples of how to use the dashboard in just a bit. But first, I want to explain more about where the data in the dashboard is coming from. So the first tab of the Community Living Dashboard provides data on who needs LTSS, which comes from the 2021 American Community Survey, which is collected by the US Census Bureau. And this data set, it's nationally representative, and we're specifically focusing on this dashboard on adults ages 18 years and older. So the dashboard's giving estimates of the number of adults in the US who need LTSS. Next slide, please. So to define LTSS need using the American Community Survey, we're using two questions from this data set to determine who needs LTSS. One is the self-care disability question, which asks about serious difficulty with dressing or bathing. And then the second is a question that asks about independent living disability, which they frame as difficulty doing errands alone, such as visiting a doctor's office or shopping due to a physical, mental, or emotional condition lasting at least 6 months. So the way we construct who needs LTSS then is we consider a person to need LTSS if they respond yes to either one or both of these questions. Next slide, please. So then for the second tab of the Community Living Dashboard, we're looking at who receives Medicaid LTSS. And this data is coming from the 2021 Transformed Medicaid Statistical Information System, or TMSIS, which is a mouthful. And so this is a CMS system that collects Medicaid claims and encounters data. It's mostly reported by states. And in comparison to the American Community Survey, which is a sample of adults in the United States, this Medicaid data that we're using here includes the entire population of adult Medicaid beneficiaries. And so TMSIS is really the most comprehensive data that we have that currently exists on Medicaid for US states. But I do want to recognize that there are still some concerns, particularly with the quality of this data, that I think are important to be aware of. Next slide, please. So this is a map of the US that shows the quality of race and ethnicity data for home and community-based service users in the Medicaid TMSIS data. So states that are marked in this reddish color are considered high concern because 20 to 50% of adults with HCBS in that state are missing race and ethnicity data. This includes states like Massachusetts, New Jersey, DC, South Carolina, Florida, Kentucky, Indiana, Iowa, Utah, and Arizona. There are also concerns about how accurately the race and ethnicity data reported in TMSIS actually reflects the racial and ethnic distribution of Medicaid recipients, in addition to having high rates of missingness. And we also here, you might notice Alabama and Mississippi are excluded, and this is due to concerns with the quality of their LTSS data as well as demographic data issues in these states that made it impossible for us to look at that data quality here. But even though there are these issues with the quality of race and ethnicity, so we're not able to look at all states by race and ethnicity, the TMSIS data still provides incredibly useful information about Medicaid and LTSS, and we can keep pushing for states to improve their data collection efforts. Next slide, please. So for the who receives Medicaid LTSS dashboard, how are we defining LTSS users? So to determine who receives Medicaid LTSS, we followed a method that is used by CMS in their recent long-term services and supports reports that are put together by Mathematica. And the Medicaid Home and Community-Based Services, or HCBS, includes then 1915C waivers, 1915I HCBS state plan options, 1915J self-directed personal assistance services, 1915K community first choice, PACE, personal care services, home health, rehabilitation services, case management, and private duty nursing services. And then LTSS also includes institutional LTSS, which is services provided in nursing homes, mental health facilities, and intermediate care facilities for people with intellectual disabilities. Next slide, please. So overall, in our dashboard, we find and estimate that 17.6 million adults need LTSS in the United States based on that American Community Survey data. And then in TMSIS, we find that about 6.4 million adults receive Medicaid LTSS in the US, though that number does exclude Alabama and Mississippi. Next slide, please. So we aren't necessarily kind of directly comparing these numbers statistically speaking, since they come from different data sets with different samples or populations. However, we can still tell that there is a large discrepancy in the number of people who need LTSS versus receive Medicaid LTSS. So why does this large discrepancy exist? One factor could be that not everyone who needs LTSS qualifies for Medicaid based on financial or functional eligibility criteria in their state. And though Medicaid is the primary payer of formal LTSS in the United States, there are many people who receive services through other sources, for example, through Medicare for post-acute care, private long-term care insurance policies. Many people pay out of pocket or rely on informal supports and unpaid caregiving, for example. And so this large discrepancy, though, also likely reflects that there are unmet needs for LTSS. So this dashboard can be used for policy and advocacy efforts to defend Medicaid and expand access to Medicaid LTSS, particularly home and community-based services, so that everyone who needs LTSS has access to the services and supports they need to live and thrive in the community. All right, so now I am going to actually share my screen here with the dashboard itself to give a bit of a demonstration. All right, hopefully that is working for others. So I do want to note that the dashboard was designed to be compatible with screen readers, but if you do encounter any accessibility issues, please do reach out to us, because we want to make sure that the dashboard is accessible to people with disabilities. So this is the Community Living Data Dashboard homepage, which has a brief introduction summary of the dashboard, as well as a video tutorial down below here. I'll show you that, where Teresa provides an overview of how to use the dashboard. And at the top here is where you can navigate between the different tabs. So first, let's look at who needs LTSS. So we'll click on who needs LTSS box. It takes a minute to load often. I think it's just a lot of information for it to pick up. So this is kind of what our dashboards generally look like. Explains kind of what our dashboards are telling you about. And then here is kind of the main information is going to be under this descriptive statistics for the United States. And we see the number and percent of adults with LTSS needs at the national level at this point. So that's the 17.6 million that I mentioned earlier. We also have filters that you can apply. And down below, there are bar graphs that show the percent of adults who need LTSS by sex, race and ethnicity, age group, language, poverty status, and rural status. I'm going to scroll back up, hopefully not giving anyone a headache or being too dizzy. And so in addition, though, to looking at these overall national level numbers, the dashboard can be particularly useful for advocacy to look at who needs or receives LTSS in your state. So for example, let's say you live in Georgia and are working on advocacy efforts to address the long waiting lists for home and community-based service waivers. And it might be helpful to provide an estimate of how many adults need LTSS in Georgia, provide this to policymakers. And so in this case, we would select under the state select drop-down menu towards the top, the state of Georgia. You can click the box next to the name Georgia. And now you'll notice here that Georgia is the only state highlighted in navy. And we can see that these numbers under descriptive statistics for Georgia now say that the number of adults who need LTSS is about 538,700, which is about 6.6% of adults in the state of Georgia. And now if we scroll down, we can see the percent of adults who need LTSS in Georgia by the different demographic characteristics in the bar graphs. But let's say maybe you're more focused on the elderly and disabled waiver in Georgia and want to know about how many older adults need LTSS. So we can filter specifically to older adults. Under the filters for age group, you can select the drop-down menu and pick 65 plus. And the data now tells us that there are about 250,000 older adults in Georgia who need LTSS, which is about 16% of older adults in the state. And then if we scroll down to the bar graphs now, you might notice here under age group, this bar graph for 65 plus now says 100% because we filtered to only this population. So if you apply more filters, more of those bar graphs are going to switch to say 100% of whatever the group is that you've selected. If you want to clear your state or filter selections, there is an option under here. It's under this age group drop-down menu, and you can click the arrow next to where it says clear selections, and it's going to take you back now to the national level numbers. There are also, if you go by hover kind of over the top right corner of any of the drop-down menus, there's a little eraser that appears that you can clear that individual selection if you don't want to clear all of the other choices that you've made. Now, there's also an option at the top of the dashboard to switch between graph view and table view. So we're currently in graph view, but if you want to switch here to table view, this can be helpful. It might be more accessible for folks, or it also has more specific numbers and percentages here that are not necessarily available in the graph view. So now I think, well, I'll show you underneath the dashboard, there are a list of frequently asked questions. So this is going to provide more information about the data we're using, different measures and other frequently asked questions. And towards the bottom, we have these options. Depending on the size of your screen, often this will also be on the top left, but for me here, it's at the very bottom. I can switch between the tabs to now look at who receives Medicaid LTSS. So we're going to switch over to this second tab now. And for some reason, often this pops up on my computer a little bit smaller. So if you scroll down to the kind of bottom of the dashboard, there is a sliding bar where you can zoom in to make it bigger. So that is helpful to know. And so this dashboard is set up quite similar to the previous one. One difference you might notice here, again, Alabama and Mississippi are grayed out in our US map, and this is because they're excluded for the data quality issues I mentioned earlier. And here, our box of descriptive statistics for the United States is telling us the total number of adults who received Medicaid LTSS, which is that 6.4 million number, as well as among those who's receiving only HCBS, which is about 5 million, who's receiving only institutional LTSS, about 1.1 million, and then the number who are receiving both HCBS and institutional LTSS within the same year, which is 235,000 here. We can again filter who receives Medicaid LTSS by sex, race and ethnicity, and age group with these drop-down menu filter options. And the bar graphs here are going to show you the breakdown of the different types of services received among each subpopulation. So for example, we would say here among females that about 78.8% of females receive only HCBS, 17.6% receive only institutional LTSS. Then if you hover over this little gray part in the middle, that's going to show us that about 3.6% of females are receiving both types of services in 2021. And so, yeah, if you want more specifics, for example, of the numbers, you can hover over the bar graph to find those counts. And then, as we did before, we can choose to filter to a specific state. I'm going to pick on Massachusetts for a second. So we can select the state select drop-down menu, scroll down to Massachusetts. Now Massachusetts will be the only state highlighted in navy. We can see the total numbers here. And then under race and ethnicity, now we see this big note that says data not available due to quality concerns. So Massachusetts is one of 14 states where you'll see this note, and we have excluded race and ethnicity data for these 14 states because CMS categorizes them as having high concern or unusable race and ethnicity data overall in TMSIS in 2021 due to missingness as well as concerns about the accuracy of the data. And so we do want to encourage everyone to explore the dashboard and learn about the quality of race and ethnicity data in your state, which this information then can be used by advocates to put pressure on states to really strengthen data collection and reporting into TMSIS, which is really critical for research and policy efforts to improve access to services. But let's look at one more option. So I'm going to clear this selection and pick a different state. Say perhaps you work for a health plan and are developing a more targeted program to improve access to home and community-based services for Native American adults in Oklahoma. Maybe you're writing a brief related to this topic. You might find it helpful to highlight some specific data or numbers on who currently is receiving Medicaid HCBS among the subpopulation. So you'd first want to select Oklahoma from State Select drop-down menu. There we go. And then from the race and ethnicity drop-down menu, you're going to need to select all. I have found that to be a little quirk, and then pick American Indian, Alaska Native in this case. And since we're particularly interested in home and community-based services in this scenario, we can also select under the services received, which is underneath the state select, we can pick only HCBS if that's what we want to look at. So now if you scroll down though, you're going to find that these bar graphs are not particularly helpful since they were showing the kind of percentage of HCBS versus institutional LTSS. Now they all say 100%. So it might be more beneficial for us then to look in the table view, which again is in the top corner that you can switch that way. You will have to make your selections again. So I'm going to pick Oklahoma, only HCBS, and American Indian, Alaska Native here. And the tables are going to then show us the number of Native Americans in Oklahoma who receive only HCBS broken down by sex and age group, for example. And we have the specific numbers and then the percentage of those populations. I think that one really helpful way to think about home or how to use the dashboard is to kind of look at both the who needs LTSS and who receives Medicaid LTSS dashboards next to each other. So I pulled up here who needs LTSS. This is the ACS, our American Community Survey dashboard. I've already selected here Oklahoma and American Indian Alaska Native, and we can see approximately 17,500 Native American adults in Oklahoma need LTSS. But then we can compare this then to who receives Medicaid LTSS, which is about 2,600 people among this population, and of whom 1,500 are in receiving home and community-based services, whereas 1,000 are still receiving services in institutional settings. So you could use these numbers then to pressure policymakers and states to really expand access to LTSS, particularly home and community-based services, for example, for this population, as that seems to be a strong need. And then this is just one example, but I think we would hope that you take some time to kind of play around with the dashboard, look at the state that you live in, and see how this can really be relevant to your work and advocacy. And before I wrap up, I did want to mention also that our hope is to really continue to update this data with more recent years of data that have been released, as well as kind of on an annual basis as data is released in the future, though just in reality, I guess much of this does depend on kind of continued funding for data infrastructure and availability that we hope the Medicaid data and census data will continue to be available. But we are planning to then release, which here I'll scroll to the bottom. Sorry, close your eyes if you're can be dizzy. A third tab here that says disparities in LTSS, which right now is just going to say coming soon. But we hope that that will be available soon, so stay tuned. And there's also an option towards the bottom to share feedback or thoughts in a survey if you would like to do that. I think we can go back to the slide deck now, so I will stop sharing. And believe on the slides we have kind of our social media information, as well as a link to sign up for our newsletter, which these slides will be sent out to you all. And then you can also feel free to email us with questions or inquiries or concerns of accessibility at clequity@brandeis.edu. But now I'm going to pass it over to Nicole to share more about the Parenting with Disabilities Dashboard.
Hi there. Thank you, Lauren, and thank you, Teresa, for sharing all of that information about your dashboards. My name is Nicole Lamerson. I'm a research associate at the Lurie Institute for Disability Policy, and I work primarily with the National Research Center for Parents with Disabilities. As a visual description, I am a white woman with long brown hair and a ponytail. I'm wearing pink headphones, and I have a blouse that is white with blue flower pattern on it. Next slide, please. So just a little bit about us. The National Research Center for Parents with Disabilities is a cross-disability initiative and grant, and we're guided by the ethos, nothing about us without us. We conduct trainings, research, and advocacy for looking at parents with disabilities, and we also provide information and support for parents with disabilities and their families when we can through a technical assistance model, although we are not a service providing organization. And of course, we are part of the Lurie Institute. Next slide, please. So just a quick note on funding, like the CLEC and CLPC, we are funded by NIDLR, the National Institute on Disability, Independent Living, and Rehabilitation Research. And the contents of this presentation are our own and are not necessarily reflected of our funders. Next slide. So I just want to take a moment to lay the land here. Give you a lay of the land about parents with disabilities. About 7% of all parents in the US have some form of disability. That works out to be about 4.5 million, 4.6 million. And it works out to be about 1 in 10 children in the US having a parent with a disability. But this is a population that doesn't often receive a lot of attention. And disabled women, this is important because disabled women are actually having children at about the same rate as non-disabled women and have unique needs that are unmet in their parenting because of all of the societal barriers we know that exist for people with disabilities. Disabled parents are more likely to report health disparities and socioeconomic disparity, such as housing, food, and economic insecurity. And key for my presentation today is the intersection between parents with disabilities and the child welfare system. Disabled parents are more likely to have child welfare involvement, and when they have child welfare involvement, they are more likely than non-disabled people to experience termination of parental rights. This is a huge concern in this community, and it seems to be this underlying thread through all the work that we do and all the parents that are so generous to share their stories with us. This very, very real concern about child welfare agencies getting themselves involved with parents with disabilities who may, and these agencies may not have an understanding about the ways in which parents with disabilities parent, and often are unable to provide the sort of accommodations that parents with disabilities may need. And I just want to disclose very quickly, I'm a parent with a disability. I'm using a wheelchair. So I come to this particular subject wearing lots of different hats. Next slide. So the problem that we see in this population is that disabled parents don't really have a policy home. Existing disability policy doesn't particularly or adequately address the needs of disabled parents. So one key example of this is long-term services and supports. You're living in the community, you're integrated into your community, you have relationships. That leads to having a child because you're in the community and taking, having supports within the community. But for example, say you need personal care attendance services. Well, many states specifically and explicitly prohibit PCAs from doing any form of child rearing activities. Parental activities are not often included as an ADL. So, for example, a PCA could do my laundry, they could cook me dinner, they could help me get dressed, but could they help my daughter? No, they couldn't. So we have that barrier, but then we have this other barrier where the existing supports and services we have for all parents, so for example, things like WIC or early intervention or postpartum nursing visits, those supports that may exist for a larger population of people who are parents don't know how to address the needs of parents with disabilities. And in some cases, aren't really aware that disabled parents actually exist. This seems to be also a very common thread running through maternal child health. So we're left with this equation that results in disabled parents having many unmet support needs and no formal structure for supports. And the way that we go about remedying this is looking at the data. And that is that was our aim with this particular dashboard, which is to show you this subset of disabled people in the US who are parents. Next slide, please. So we need this data to learn more about parents. And of course, we know data can be difficult to access and interpret. So that was a main driver behind both this dashboard and of course, Teresa and Lauren's fantastic work. And our dashboard provides information about disabled parents, which can be sorted by state, disability type, sex, and socioeconomic status, taking into account federal poverty level. Next slide, please. Our data source is the American Community Survey, which is collected by the US Census Bureau. It is the largest and most comprehensive survey in the US, and the ACS typically samples about 3 million people every year. The sample that is currently informing our dashboard is a 5-year sample from 2018 to 2022, which pulls the data from about 15 million people sampled to represent a 5-year average. And it gives us numbers that are large enough to drill down by state and the previous categories that I mentioned. Next slide, please. So how do we measure disability? This is going to seem a little bit familiar from Lauren and Teresa's presentation, but we measure disability by using a set of 6 yes or no questions. These are in the ACS, and they are also in other data sets as well in data collection efforts. And respondents answering yes to more than one category are classified as having a disability. And for those who identify as having more than one disability, there is a multiple disabilities category within the ACS and also in our dashboard. Next slide, please. So these are the questions, and the last 2 are going to be familiar to you because those inform the CLEC's dashboard. But the questions are you deaf or do you have serious difficulty hearing? Are you blind or do you have serious difficulty seeing, even when wearing glasses? Because of a physical, mental, or emotional condition, do you have serious difficulty concentrating, remembering, or making decisions? That is a question that captures cognitive disability. Do you have serious difficulty walking or climbing stairs? That captures physical disability or mobility disability. And then the last 2, which are familiar to you, do you have difficulty dressing or bathing, which is self-care? And then difficulty doing errands alone, such as visiting a doctor's office or shopping. That, of course, is an independent living disability. Next slide, please. So the ACS collects information on parental status. And we determine parental status as any person aged 18 years or older co-residing with children under 18 years in the household. So generally, we would see parental status, whether or not someone in the household is a parent, in the data. However, there is a small subset of the data which it's not readily apparent who is doing the caretaking. So we first tried to assign the mother or the father. And when we aren't able to do that, we then look at grandparents, the oldest adult in the family unit, or the oldest adult in the household. But the vast majority of this data is capturing mothers and fathers. Next slide, please. So individuals in this sample aged 18 and over were classified as a parent if they had a minor child assigned to them within the data based on that order of priority. And there is a key limitation to this data, which it does not capture parents who are not co-residing with children under the age of 18. And this is a bit challenging for our population because, as I said earlier, this is a population that often will lose custody of their children due to family court or child welfare proceedings, and we are not capturing those dyads and triads of parents, mothers, and fathers with disabilities who, for whatever reason, do not have their children co-residing with them. Next slide. Just some use cases for our dashboard before I dive into it. As I said, there is sort of this lack of a home for policies around disabled parents. So we hope that disability organizations such as ILs or PNAs could use the data in this dashboard to make cases for outreach to these families. Also, maternal child health programs, tailoring outreach programs, be it home visitor programs or doula programs under Medicaid, lactation consulting, WIC, tailoring outreach for parents with disabilities, and also HCBS advocacy for parents with disabilities. I think taken as a whole, the HCBS dashboard and our parenting dashboard provide really compelling data that can be used in arguments for expanding services for these populations. Next slide. I think actually I'm going to screen share. Thank you. Okay, so when you click on our data hub drop-down box right here, that is how you reach our Parents with Disabilities dashboard. And the first two pages of this dashboard are interactive maps. I'm going to show those to you. These maps are sort of the why for why we created this dashboard. This first map shows current state legislation that supports parents with disabilities. So all of these states in green have passed legislation that protects parents with disabilities in either family court, child welfare proceedings, or both. These laws vary greatly. Some states provide explicit protections for certain populations of disabled people, and other states do not. So for example, let's click on Ohio. And when you click on that, you'll get the text of the bill in Ohio, which covers all disabilities and was passed in 2023. And then you can scroll down and you can see the key points of the legislation. So this is a really important tool if you want to look up and see what protections exist, if any, in your state for parents with disabilities. And as I scroll over these, you can see that there's a tooltip that pops up. And then blue states have pending legislation. Gray states, unfortunately, do not have legislation as of yet. And then Vermont is our outlier, who has one bill that has passed and another one that is pending. And then I want to show you our next interactive map. And this is sort of the antithesis of that first map. These are maps of states that terminate parental rights based on parental disabilities. So these states all have statutes that allow for the removal of parents with disabilities having their children removed because of parental disability status. And all of these varied and different colors on this map represent different categories of folks diagnostic categories who are explicitly mentioned in the language of the bill. And I think what is really important to note here is that a state may have laws on the books protecting a certain population of parents with disabilities from discrimination based on their disability in their parenting lives. That same state may also have a statute on the books that allows them to explicitly terminate the parental rights based on disability of the parent. So it's sort of these things are not mutually exclusive. We're in sort of a gray area where we're getting protections, but we're still raising awareness and advocacy. So I encourage you to check out these maps and have a look and see how your state is doing. And then I'm going to now go to our dashboard. And this dashboard is going to look familiar because it's the same standard template that the other dashboards have. Up at the top of the page, there is a toggle box that allows you to display the dashboard in Spanish. And then below that, on the right-hand side of the dashboard, you can either view the dashboard in graphical view or in table view. I'm going to go back to graph because that is just a little bit easier for my eyes. Right now, our dashboard has all states highlighted. So the statistics here on disability prevalence are for all parents in the US with disabilities. So we see that about 6.87% of parents with disabilities in the US. But I want to drill down a little bit and look at an individual state. I'm going to pick a big one. Let's go with California. Okay, so now we see on the dashboard that only California is highlighted. And we see 5.4% of parents in California have any disability. And I just want to highlight this dialog box, this tooltip. I have a visual disability that makes scanning across lines of data very difficult. So I especially appreciate this little pop-up box that shows me the data that I need, and that is also compatible with screen readers. So we see that 5.4% of parents in California have any disability, and then you can look down at the other categories, for example, and we see that 1.8% of parents in California have a cognitive disability. And another thing that's really important to keep in mind for this data is that all this disability information is based on self-report. And we know that some parents are not going to want to disclose in a government survey their disability status. So that is definitely something that we have to keep in mind when we're working with this data for any reason. So let's take a look. Let's drill down into the data a little bit more. We're going to stay in California, but let's scroll down. We can filter the data by sex, by race and ethnicity, and by poverty status. This is above the federal poverty line and below. So let's take a look at female parents. So I'm gonna uncheck select all and check female. And then so you see at the chart at the bottom of the page, at the bar chart at the bottom of the page, we have female parents only, no male parents are in the bar chart. And it also is important to mention that this data is capturing sex and gender in a dichotomous mode, so male or female. Let's change our race and ethnicity to Hispanic. Oops. There we go. And if at any point, if you're drilling down into this data and you can't remember, you're unsure or a little confused about what you're looking at, these applied filters will give you the lay of the land. So we're looking at California, we're looking at only female parents, and we're looking at parents who are Hispanic and of any socioeconomic status. So we can see here that 5.6% of all parents in California are 5.6% of mothers. This is an important distinction. When we drill down in the data by sex, the denominator changes from all parents to all parents who match that gender. So now we're looking at all mothers. 5.6% of all mothers in California are Hispanic, and in this case, have any disability. We can scroll down. Let's look at vision disability, for example. For vision disability, we see that 1.5% of all mothers in California, 1.5% of all mothers in California are Hispanic and have a vision disability. So you can drill down and play with these numbers. I will say that because we're dealing with a subset of a subset, if you're in a small state and your population's low, so for some of these categories, you might not get a data point, because when the numbers get too low, then the data can be tacitly identifiable. And we certainly don't want to, tacitly identify anybody. So that is also a limitation. You can clear your selections with this little clear selections button that is across from applied filters. And then you see we're back to looking at the United States, all parents, male and female, all races, and poverty status. And then you can also adjust the size of the text, just like the other dashboards, using this slider. And we have FAQs here as well. And there is an email address, Center for Parents at Brandeis. If you have any questions about our dashboard, we look forward to talking to you about it. And there's also, like with the Community Living Equity Center, on the landing page, there is a video tutorial where you can see me going through this again, step by step, should you ever need it. So I want to thank everyone so much for having a listen. And it looks like we have about 3 minutes. I'm going to stop screen sharing if we want to take any questions.
Thank you so much, Nicole. This is wonderful. Thank you again to Lauren and Teresa. I think for the sake of time, I want to highlight the post-webinar survey I've shared in the chat. That should also, I believe, open up as a browser window when you close the Zoom webinar. But you can also access it using the link in the chat. I also want to clarify that we have noted all of your questions. Thank you so much for sending in such thoughtful and really important questions, either in the Q&A or the chat. We've documented all of those. So when we share the recording of this webinar along with the slides, we will also share a frequently asked questions document that will answer these questions, because there are some similarities in the questions and we want to make sure we're being thorough and accurate in our responses and get those out to you. Lastly, I'm putting in some information about the Lurie Institute on, for our social media and our various newsletters. So I'm going to put that in the chat right now if you're interested in following. And I put that in there because when the webinar is recorded and made available, we will be posting the recording, the slides, and the FAQ on those channels and in our newsletter. You also can find it on our YouTube and, search it when it's ready. But I just wanted to make sure that you had those things. So again, thank you all so much. I'm going to post the post-webinar survey again in the chat, but I hope you all have a great rest of your day, and thank you so much for attending our webinar.